This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk on this Monday. Thanks for joining us on WHAR. I'm Kyle Wiggs, and I'm privileged to be joined by Dr. Melinda Cooper. She's with Mon Health Wedgwood Primary Care and Psychiatry. And Dr. Cooper, good morning. Thanks for coming on.
Good morning, Kyle. Good to be here.
We appreciate your time. First of all, tell us about you, where you're from, and where you were educated.
So I grew up in Mineral County, outside of Kaiser. I came out to Morgantown for undergrad and did a bachelor's degree in engineering, and then decided I really would like to go into medicine. So been in Morgantown ever since.
All right, so Mineral County, Kaiser High School, is that right?
That's right.
All right, very good. The world-famous Mineral Bowl there between Kaiser and Frankfurt, big rivals. In
big rivals, yes.
All right, so your specialty is, I would imagine, children, right? Pediatric medicine?
Absolutely, yes. So I am a pediatrician, also so I'm board certified in both pediatrics and internal medicine. I did a combined residency, but I really have a passion for pediatric medicine.
What drew you to that?
I've always really been interested in helping to care for others, and really enjoyed, more particularly, being able to take care of kids and helping them to, grow and develop. And it's just really entertaining to be around children all the time, especially when they're well known for not having filters and just saying whatever comes to mind.
I've been there. I know all about that. Okay, so Mon Health, what about your history with Mon Health? When did you start?
So I've been with Mon Health for 5 years now, and I've really enjoyed it. I've enjoyed being able to make the patients our focus on care, and I've enjoyed being able to kind of tailor my practice to what I really enjoy.
Okay.
Great.
And the Wedgwood facility that's in the Cheat Lake area, right?
Well, we actually have 3 locations.
Okay.
There is one office in Cheat Lake. I'm actually located at the office at the medical park, just down the hill from the hospital. And then there's a location over at the Gateway, over near Hobby Lobby and the Harley-Davidson store.
Okay, so Wedgwood has expanded as well, but you're on the campus there. You're on the Mon Health campus.
I am, yes.
Okay, very good. Well, we brought you on this morning to talk about well child visits. And go ahead and describe that. What is a well child visit, and what does all of that encompass?
Essentially we talk about wellness visits and the need for preventative care for adults, and this is the same thing for children. But for kids, we're much more focused on making sure that they're growing and developing healthy. We want to make sure that we're looking after their physical growth and well-being. We want to make sure that they're healthy weights. We want to make sure that we're looking at their developmental milestones and able to potentially catch some developmental differences and find ways to help improve those. And we're able to look at looking at their emotional needs as well. So it just depends on the age of the child, the things we have more focuses on.
Mm-hmm. And I know every situation's different, and there's many, many, many things you look for. But what are some of the most important milestones that when you start seeing a child at 1 or 2 years old, what are you looking for?
So at those early ages, we're looking to see, are their speech developing as we would expect? Are they learning their communication skills and social skills? How are they interacting with their family members and with other children? We're looking for their gross motor skills with whether they're walking and getting around like they're supposed to be. As they get older, we start to look at, transitioning to other more emotional types of changes that we see as well, and looking at how they're interacting with their peers as well.
Vision and hearing, that's all a part of that as well?
It is, yeah. So we oftentimes different stages will, especially when they're getting ready to go into school age, we'll look at doing hearing screening and vision screening. But if there's concerns at younger ages, we may even look at doing hearing testing earlier to make sure that that's not a reason why their speech might not be developing.
So if you detect a problem with perhaps speech not developing as it should, or some of the motor skills, then you can send a child to occupational therapy, right? Different types of therapy,
Sure.
audiologists, that type of thing.
Absolutely, yeah. So, and particularly for younger children, West Virginia has the Birth to Three program, which is a great service for many families, and it's free to the families as well, which ensures that financial issues aren't a limitation for kids being able to get the care that they need.
Okay, so
very good services.
Yeah, Birth to Three. Go into that a little bit more. Again, some families may need some financial assistance, right, to get their kids extra help?
Absolutely. So, yes, the state wanted to make sure that we didn't have kids that weren't able to, get the help that they needed. So they have options with the developmentalists, they have speech therapists, physical therapists, occupational therapists that can all come in and assess the children in the home. So families don't even have to travel to different locations. They come into the home, they do those evaluations, and then they'll set up a schedule to come in and work with the children so that they can make sure that they're catching up and meeting those milestones as much as possible. So it's a wonderful service that I think any family can use, and families can even make their own referrals. They can even call and request that to be started on their own.
How do people find out more about that? Is there a site for that particular program?
Yes, it's through a state-funded program. So just do an online search for West Virginia Birth to Three. I'm sure we'll get you there.
All right, West Virginia Birth to Three. Okay, so if a youngster next year in August is getting set for preschool, pre-K, or kindergarten, or first grade, and now's the time, right? Now's the time to get that child visit in the spring or the summer. I would imagine you see a lot of kids that are preparing for school maybe later on this summer. So get that appointment scheduled, beat the rush, right?
Absolutely. And now is the time that they're really just kicking off the registration for pre-K and kindergarten enrollment. So it's definitely important to get that taken care of now. And then later on in the summer, there's always that rush right before school starts when the school's giving reminder calls that let's get it scheduled early so that we can get those out of the way.
And maybe some of the older kids that are going to participate in activities this summer, maybe a T-ball league or a summer basketball league. I know one of the other things you offer is physicals for children.
Yes, and honestly, most pediatricians, if they're having kids that they're following routinely and they're having their well child visits, those well child visits we're gonna include the same things that we would for sports physicals. So, and even kids that are doing school-based types of programs that need a sports physical paperwork signed off on for them to participate in school activities for those athletes. That the well child visits are going to account for being able to cover all of the things that we would need for sports participation as well.
All right, so we've covered sports physicals. We've covered perhaps some of those milestones that you look for physically and with speech, verbally, that type of thing. What are some other things that a well child visit encompasses?
So some of the other things that we often talk about are looking at other preventative screenings. We also are looking at, we've seen a lot more childhood obesity. So talking about nutritional changes that we might be able to make and physical activity goals. We often, different ages, we would offer screening for cholesterol levels, particularly if there's a family history of high cholesterol. There may be genetic reasons that a kid could have high cholesterol, and we would want to be able to know and start changes early on. And then the big thing that we get asked about a lot are their immunizations. And we need to make sure that we're keeping kids healthy and we're giving their immune system the tools that it needs to be prepared for these illnesses that can be very devastating. We're seeing measles outbreaks in the United States right now, so that's a big question we've been getting about ages for measles vaccines. But we have so many great vaccines that can help to prevent numerous terrible diseases that thankfully we don't see that much anymore.
Yeah,
but important to discuss those.
Yeah, absolutely. And the measles thing, that I guess primarily Texas, there's been a big story late in the winter and the spring with a big measles outbreak in Texas with some of the unvaccinated population. Fortunately, correct me if I'm wrong, but we haven't seen it reach West Virginia yet, right? Because West Virginia,
not yet.
Yeah, among the school-age kids, the West Virginia does very well in terms of vaccinations to this point.
Absolutely. Yeah. Last I looked at the CDC webpage, I think West Virginia actually has the highest immunization rate for kids entering kindergarten of all of the states. So that was a nice thing for West Virginia to be recognized for something good.
Yeah, absolutely. And you said pretty emphatically there, not yet. So in terms of a measles case in West Virginia, do you kind of see it being inevitable because of the relaxed nature of the vaccine laws here now?
I really hope not, but that's my concern. There have been a couple of different attempts for bills to be passed to allow for more exemptions for school-age kids. The fact that we haven't allowed for things aside from medical exemptions is a main reason why West Virginia is the top of the list in maintaining that vaccine rate. And I've seen a lot more vaccine hesitancy in younger families. And I feel like if we allow that to relax more so, then yes, I think we were very much putting our children at risk for that being more widespread.
Okay, the phrase you used there was vaccine hesitancy, and for measles and maybe some other things that have been eradicated. What's your message to a family who comes in with a young child and they're a little bit hesitant, they're not sure because they've heard some things or read some things? How do you assure them, and what do you tell them to kind of get them to the point where they're okay with the vaccines?
I usually want to know where their starting point is at first. So what are their concerns? I've had lots of concerns that span a wide spectrum of different things. And so usually wanting to understand what exactly are they concerned about. Is it the number of vaccines at one time? Is it the different components in the vaccines? Understanding what exactly concerns they have. And then just trying to present them with the facts, the scientific evidence that we have that supports the safety and the effectiveness of these vaccines, most of which we've had available for numerous decades. I think just understanding that and helping them to, see and understand what evidence we do have, and then trying to come up with a plan that they're comfortable with and that we can do to try to protect their children to the best of our ability.
Right. We're with Dr. Melinda Cooper. She's with Mon Health Wedgwood Primary Care and Psychiatry. We're going to take a break. This is Mon Health Talk for this Monday. We're talking well child visits and what that all encompasses. We will continue the conversation. Stay with us as Mon Health Talk continues on WAJR right after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday. Dr. Melinda Cooper with us, Mon Health Wedgwood Primary Care and Psychiatry. We are talking about well child visits and everything that goes into that. And Dr. Cooper, welcome back to the show. Again, thanks for your time.
Thank you.
How important is sleep? And when a child is having issues with sleep, what are some of the solutions there? How can you help in that regard?
Some of it would depend on the age of the kid. We see some sleep issues in younger kids because of things like night terrors or just poor routine and poor bedtime habits. So sometimes just working with family on different techniques that we can try to do to set that time to let them learn to get to sleep. For teenagers, it's commonly more just wanting to stay up late and be social in the evening hours, so just working on different habits. But sometimes we do see other sleep medical issues as well. And there are some different pediatric sleep physicians in the area that we sometimes would need to do sleep studies as well to see, are there some issues because of tonsils and snoring or because of other sleep disorders.
Mm-hmm. And you mentioned, obviously childhood obesity is kind of on the rise a little bit. In terms of nutrition, how can you help a family or a youngster with that trying to eat better? I'm sure there's things we can all do to create better nutritional habits.
Absolutely. And I think a lot of it comes with the families having that mindset and setting the examples of everybody trying to be more healthy and nutrition-minded. For kids particularly, I don't really want to set weight goals per se, but let's look at what we're doing. Are we having too many sugary snacks, a lot of juices or sodas, too many sweets that we're having after school? Are we getting enough vegetables in our diet and, having enough of those and fruits as our snacks? Are we doing enough with those things? And are we being as active as we should be and trying to limit how much screen time we're having? So things that I think all of us could benefit from doing.
Yeah. One thing about Monongalia County, I think the nutrition content of the lunches in this county at all the schools is very, very good. Is that kind of what you've seen?
Yes. Yeah, they definitely have made more of an effort to improve the nutritional content of the food that they're offering for our kids. And I think it starts with that for a lot of the kids. That may be the largest amount of their nutritious meals that they might get in a week's time. So it's definitely a very important program to have.
Mm-hmm. All right. Physicians also screen for mental and behavioral health concerns. Our kids are under a lot of pressures now with social media and that type of thing. And there's always academic pressure and stress. There's athletic stress and pressure. We got about a minute or so left in the program. Talk about that, how you can help a young person or their family navigate through some of that.
Yeah, it's definitely a common thing that we see, and just trying to get them the right resources, whether it's working just with our family units about how to have that open discussion, but definitely getting them in with some therapists or, getting them on with different support groups and things that might be available. So just having that outreach and connection that we can do to give them the support that they need.
Mm-hmm. So the Well Child Visit encompasses all of this that we've talked about here over the last half hour or so. If a child hasn't had a Well Child Visit recently, the past year or so, how would they go about contacting your office and getting one scheduled?
So my office, they can call 304-599-9400 to schedule anytime, and then also can find our information for the office through monhealth.com/primary care.
All right, monhealth.com/primary care. And, if parents have a question on any of these things we've talked about, nutrition or vaccines or anything, they can call that number, right, and get some answers.
Yes, definitely. We can get appointments set up, and we can have those discussions and make sure we're addressing all their issues and concerns.
All right, great information, Dr. Cooper. We appreciate it. Thanks for your time, and we'll talk to you again.
Sounds good. Thank you so much.
Dr. Melinda Cooper there with Mon Health Wedgwood Primary Care and Psychiatry. Again, the number for the Wedgwood Primary Care at Medical Park, 304-599-9045. 400 or go to that website, monhealth.com, and they can work with you right there. That is Mon Health Talk for this Monday. Thanks for listening, and stay with us here on WHAR.